Serious doctors of Reddit. What is the rarest disease that you've encountered in your career? Rare and interesting would be pentalogy of Cantrell, which has the heart outside of the chest because the sternum has not fused. I'd seen it before with just a bit of the heart on view. But with this kid it was completely out. You could see pretty much the whole heart with the aorta and lung vessels all that was holding it. The heart just beating away. I'd done adult cardiac for a bit, but this was a little different. Tiny. We covered it with a polystyrene cup. Until the kid went or theater to have it pushed back inside. It's meant to be 165,000 live births. The rarest I've encountered is kid syndrome Parasitis ichthyosis deafness. A 5-year-old. Very sweet. Blind girl who literally had rough, thick, opaque skin on the surface of her eyes. Coup de sabre. It's a rare form of scleroderma that makes your skin looks like you've been cut by a knife down the center of your face. This poor lady's mandible actually split in half. Gorham's disease, aka vanishing skull syndrome. A softball-size area of my patient's skull disappeared and left behind a soft spot. She ended up with a plastic plate to protect her brain. Crazy disease. Undefined. Pseudocyesis or hysterical pregnancy. In a woman who was an inmate in the psych wing of a prison I rotated through. She thought she was pregnant with Jesus's triplets and had grown a massive pregnant-looking belly. Was producing milk, etc. Harlequin ichthyosis. In med school there was a baby born with this. Basically their skin scales up and peels, removing that very important barrier so kids born with this don't live long. She was just a couple months old and had not yet left the hospital since birth. Fibrodysplasia ossificans progressiva FOP. A disease that calcifies soft tissue and turns it into bone. When I was a medical student, our group's cadaver had this disease. During dissections we sometimes would get poked by spiky pieces of bone in random areas of her body. Also had a spine that resembled a small turtle shell. We had a patient once. A young girl. Who was so sick that it broke our data analysis pipeline. When the code ingested a genome sequencing sample, it attempted to detect the chromosomal sex of the patient. It was using two metrics. The sample was considered female if it 1 lacked Y chromosome, and 2 was heterozygous on X chromosome, implying there were 2 copies of it. Otherwise the sample was considered male. This one sample registered as female on metric 1, no Y chromosome, but male on metric 2, very little heterozygosity on X chromosome, which was not anticipated and resulted in our pipeline crashing. Upon investigation, it turned out that the parents of that poor girl were brother and sister to each other. As a result, she had very little genetic variation throughout her genome, not just X chromosome, and was consequently very sick, with a plethora of diseases typical for consanguineous births. Brazilian doc here. I live in a really poor part of an already poor country. When I was in my pediatric internship there was this baby with hepatomegaly, big liver. In my region, the first thing that you have to think about in this cases is a disease called Kala-Azar, also known as black fever or visceral leishmaniasis. It is an endemic disease which there is a parasite transmitted by a mosquito that can infect people with compromised immune system, like people living with HIV and kids. This parasite infects the bone marrow and simulates clinical signs of acute leukemia, like chronic fever, spontaneous bruises and bleeding. The patient develops anemia, leukopenia, low white blood cells and low platelets. To compensate, some organs like liver and spleen take care of the bone marrow function to create new blood cells, and thus get bigger. This disease is really common in my region, but really rare in other parts. especially non-tropical countries like the US. Anyway, as I was saying, this baby girl, about 1 year old, was admitted to investigate a hepatomegaly. But the catch was that she kept having those episodes of hypoactivity and sleepiness, and sometimes even faintings that would then get better after she was being breastfed. We then checked and saw that she was having lots of hypoglycemia episodes. Her lab was normal, and she had no other clinical signs that would remind of Kala-Azar. Besides the hepatomegaly, the patient had HERS disease, a genetic disorder that makes you produce less glycogen due to an enzyme defect. Never hear of it before meeting this patient, and I think I'll never will meet other one. Interestingly enough, in this same time, I had a patient that was admitted with leukopenia, anemia and low platelets, that was also hospitalized to rule out Kala-Azar. But he actually had Fanconi anemia, and also really rare genetic disease. In this one, the bone marrow slowly stops producing blood cells. Besides this, the patient also has kidney, facial, bones malformation and overall physical underdevelopment. Undefined. Fetus in fetu. 10-year-old boy pregnant with his parasitic twin PT. Undefined. Case 10Y. Oh. Boy came in with enlarging abdominal mass and intermittent generalized weakness. Imaging revealed a parasitic fetus which was also growing in size. History revealed mass noted 2 years ago which enlarged rapidly the last 3 to 4 months. Within days of admission, boy's organs begin to fail with no apparent reason. He was healthy and eating well when he was admitted. Family wanted surgical intervention to separate the parasitic twin against surgeon's advice. Parasitic twin was basically starving/poisoning the boy to death. Surgeons opened the boy up and found that the boy and parasitic twin share a stomach, liver, heart, blood vessels, mesodermal organs, basically too complex to operate. The boy passed away after. This happened to a poor family in an underfunded government hospital in a corruption-infested country. The parasitic twin was donated to the hospital. It had teeth with hairy limbs with the longest curved baby nails. I can't describe it further. It is on display at the surgeon's hall. Edit 2. This happened years ago before the age of smartphones. The hospital team tried to have the tissues studied for academic purposes. There was a case report about it presented in a local medical congress, but as this happened in a third world country with limited resources, nothing came of it. I live and work in a different country now. Last undefined. Maybe not the rarest, but saw a 4 to 5 year old patient with Lesch-Nyhan syndrome on my PEDS rotation in med school. It's an X-linked recessive disease that a quick Google search tells me affects about 1 in every 400,000 individuals. It's due to a mutation in an enzyme involved with DNA recycling. The thing all med students remember about it is, for whatever reason, these patients have a tendency to self-mutilate. My specific patient had to have a procedure to have all his teeth removed because he would terribly bite his arms unless he was physically restrained. I believe he had an older brother that went through the same ordeal. So sad. But definitely one of the more memorable cases from med school. Eye doctor here. Patient had bilateral acanthamoebakeratitis. Estimated that 0.0004% of contact lens wearers will be diagnosed with this condition in one eye. My patient had it in both. Acanthamoebakeratitis is a rare parasitic infection of your cornea. Undefined. Remember, don't sleep, shower, or swim with your contact lenses on, and make sure to visit your eye doctor for regular checkups. Malignant hyperthermia in my 11-year-old patient. I was only in my second year of anesthesiology residency and I thought she was going to die. I had a salty old anesthesiologist as my attending, and she calmly led the whole team through the treatment. My patient did great and her labs were all normal when I took her to the PEDS ICU. I couldn't sleep for 2 nights and still haven't gotten over it. On my OB rotation during ER residency, I helped deliver a baby who had spots all over. Further blood testing revealed the baby had developed leukemia while in the mother. Didn't know that was really possible prior to that day. Incredibly rare. My colleagues had a patient with catecholamine-induced ventricular tachycardia. AKA every time this 13-year-old exercised vigorously or even got too scared, the adrenaline would induce a deadly arrhythmia that needs to be shocked before long in order for him to survive. Seriously.